Hello, my name's Pam, and I'm here today to talk about fifth disease. Fifth disease is a common communicable disease in childhood. It's also known as slap cheek disease. The causative agent of fifth disease is the parvovirus B19. This virus is found worldwide. Parvovirus B19 infection occurs most commonly in the winter and spring, and that's when community outbreaks are common. The incubation period is about 4 to 21 days. Infected individuals may at first experience a mild fever, headache, stuffy nose. Those symptoms only last a few days and then a rash will appear. The rash is a red rash on the face that looks like a child has just had their cheeks slapped. That's the most common symptom of fifth disease, is the slap cheek appearance. The rash may last a few days to a few weeks. It may come and go. In the last stage, stress, heat, sunlight may cause the rash to reappear. So those are the symptoms of fifth disease. However, not everybody gets symptoms. Some people may be asymptomatic. Physicians can usually diagnose fifth disease just by the appearance of the slap cheek appearance. Blood tests may be needed to determine if the patient is immune to the parvovirus B19 infection or if she was recently affected with the virus. Immunity is often developed after you have the virus. That keeps you from getting it again. There are several reasons that fifth disease is important in the practice of nursing. One reason is because the disease is often overlooked because there may be no symptoms, only the rash on the face. Another reason is that the disease is more debilitating in adults and older children. In these older children, teenagers, and adults, they may experience some arthritis, achy joints. Also, another reason that it's important is that the virus may have hematological effects on red cell production. Pregnancy complications may also develop from the virus. Infection with the parvovirus B19 or fifth disease between week 9 and week 20 of pregnancy can result in severe fetal anemia and also a high risk of the fetal heart failure, which can be fatal to the developing baby. Fifth disease is usually mild and it will usually go away on its own. There's no specific treatment for it. Treatment is usually just relieving symptoms such as fever, itching, joint pain, swelling. Sometimes they may give the children, or teenagers rather, and older adults an anti-inflammatory agent or a low-dose corticosteroid for the arthritis effects. If pregnant women are exposed, then blood tests should be performed. Now, the way that the virus is spread is through respiratory secretions, coughing, sneezing, sharing eating utensils. Infected persons are most contagious before the rash develops. Therefore, they usually spread the virus before they even know they have it. So, since the risk of spreading the virus is greatest before the signs and symptoms develop, transmission can't be prevented by avoiding infected individuals because you don't know which ones are infected. So what you want to do is try to reduce the risk of being infected by proper hand washing, avoiding people who you know are sick, and staying home when you are sick. So, in summary, fifth disease is a common communicable disease of childhood, and it is most commonly seen as slap cheek appearance.